Thanks for taking my question. I'm just wondering, in the next week or two, I mean, it looks like British Columbia is going to approach 80% of people being vaccinated 12 and up. What does herd immunity look like in BC? Is there a number that province is targeting, and is it even possible?
Yeah, there's a lot of discussion about that, I think. I know the modelers have been obsessed with the idea. And I think there's a whole bunch of things that we need to think about around what is community immunity, as I prefer to call it, or herd immunity. And partly it is a reflection of the transmissibility of the virus. And we know that a number of the new circulating strains are more transmissible. The other thing that we are concerned about and that we'll need to watch very carefully, particularly as we go into the fall, is if strains emerge around the world or here that have that our antibodies from vaccine are no longer as effective against. So those are some of the things that we need to think about when we're looking at the concept. What we do know from the effectiveness studies and from looking at different communities that even after a single dose, getting things down to a low enough level that it stops or interrupts transmission means that we can manage individual cases or individual clusters from public health's perspective. So it is a balancing of protecting enough people so that if it does arise, it's not going to spread widely. We're going to be able to isolate those people who are sick, make sure their contacts know who that they're at risk, and the probability of a contact getting sick will go down with the more of them that are immunized. So it's looking at all of those different parameters. Right now, we know that the risk of having widespread infections, explosive infections, goes down quite dramatically at about 70-75%. And we've seen that in communities like Prince Rupert and others. But we always have this unknown about the changing of the virus and how it changes both internationally and here in the province. The risk goes down the less transmission we have, but we need to watch that really carefully. So in terms of a number, we want to get everybody immunized because that's our best wall of defense around the province entirely. So everybody who is able to be immunized, we'd like to get it to 100% of right now children and adults 12 and up. We know that's not necessarily possible, but the higher the better. And the modeling helps us understand that as well. We know that the risk of things taking off or even having more severe illness in people goes down dramatically at 75, but it even goes down even more once you get to 90, and that protects even more people. So our aim of our program is to get everybody to make sure they have access to vaccine and that they're able to get both the first dose and, really importantly, the second dose. We're learning more and more that more durable and higher protection really comes about a week or two after the second dose too. So now we're in the position where that's important for all of us, and that's what's going to get us through next fall as best we can. So our aims right now are to get as many people as best protection as possible, because that protects all of us, and to drive down our transmission and the circulation of the virus in the community as much as we possibly can. And that's the goal for the next few months.